Welcome back, everyone. In this lecture, we're starting part 1 of chapter 17, which focuses on innate, nonspecific host defenses. The first section, 17.1, is called physical defenses, and this explains how the body blocks or removes microbes before they ever reach vulnerable tissues. Chapter 7 is divided into 5 sections: physical defenses, chemical defenses, cellular defenses, pathogen recognition, and finally inflammation and fever. So today we're only focusing on the first one, physical defenses, and this is the first layer of nonspecific protection. By the end of this lecture, you should be able to describe the physical barriers and mechanical defenses that protect the body, and explain the role of the microbiota as a first-line defense. Innate immunity is fast, it's nonspecific, and it's always turned on. And innate immunity includes physical, chemical, and cellular defenses. Physical defenses are the first tier. These are things like the skin, the mucous membranes, and mechanical removal mechanisms. Whereas chemical defenses include enzymes, antimicrobial peptides, and cytokines. Cellular defenses are going to involve white blood cells like neutrophils and macrophages. Today, we're going to be focusing on the physical portion of this system. Physical defenses have one job. They need to block, trap, or remove microbes before infection occurs. And they don't require prior exposure, and they don't develop memory, unlike the specific adaptive defenses we're going to talk about in Chapter 18. So there's no acquiring of defense over time, and there's no memory for physical defense. These physical defenses include physical barriers like the skin, the mucous membranes, and the endothelial cells. It also includes the mechanical defenses like shedding, mucus movement, peristalsis, tears, or urine flow, as well as the microbiome, and these are the beneficial microbes that prevent pathogen overgrowth. Physical barriers are created by tightly joined cells that microbes cannot easily penetrate, and we're going to find these in the skin, the mucous membranes, and the endothelia. There are 3 key junction types that help maintain these barriers at these sites, including tight junctions, desmosomes, and gap junctions. But many pathogens try to break these junctions apart by releasing enzymes called proteases. Here we can see the 3 junction types. We have tight junctions on the left that seal cells very tightly, and nothing can pass in between the cells. So we'll see these in the blood-brain barrier, for instance, so nothing can cross from the blood vessel into the brain. Desmosomes anchor cells with strong fibers. They're kind of like shoelaces, and we find these in cells that experience a lot of mechanical stress. So places where cells need to be really strongly anchored together, like the epidermis of the skin or the cardiac muscle, which is constantly contracting. And then finally, gap junctions are kind of like pores that connect cells and allow cell communication that occurs very rapidly. Again, we see these in the heart, so cells can contract as a unit. And understanding these junctions really helps to explain how microbes might try to invade through the tissues. The skin is one of the body's most effective physical defenses, and it has 3 layers. We have the epidermis, the dermis, and then the hypodermis. The epidermis contains keratinized dead cells that are tightly packed together, and these cells continually shed, and shed with them are the microbes that are attached to the surface, so those are constantly removed. The surface of the skin is dry, salty, and acidic, and these conditions inhibit microbial growth. We also have sebaceous glands that produce sebum, and sebum supplies fatty acids that lower the pH of the skin and make the environment hostile to many bacteria. But when the skin barrier is broken, pathogens can enter, like the fungus in Rose Gardner's disease called sporothrix, which can enter through small cuts. Next, we have our mucous membranes, and the mucous membranes line the respiratory, digestive, urinary, and reproductive tracts. They are made of epithelial cells that are held tightly together through those tight junctions, and they're also covered in mucus. mucus will trap microbes. Within the mucus, we also have antimicrobial peptides that are directly going to inhibit pathogens as well. In the respiratory system, mucus will trap inhaled particles. We also have ciliated epithelial cells, which will then move this mucus upward toward the throat in what we call the mucociliary escalator. From there, mucus can either be swallowed and destroyed in the stomach, or coughed or sneezed out of the system. And unfortunately, smoking and cystic fibrosis can impair the system, which is why these patients often develop recurrent respiratory infections. In smoking, if it has not yet caused extensive damage, the cilia might temporarily be paralyzed, but they can regain function after a short period of time. Although in chronic inflammation that occurs with smoking, it could be that the epithelial cells are so damaged that the cilia can no longer come back. They can no longer function properly. The gastrointestinal tract is lined with epithelial cells as well as goblet cells which secrete mucus. So I can see a few here and looks like they magnified one of these here. This mucus will trap foodborne microbes. Within the gastrointestinal tract, we also have peristalsis, and this is a rhythmic muscular movement of the intestines that can push the material along until it is ultimately expelled as feces. Peristalsis will prevent prolonged contact that could allow microbes to attach to and colonize our digestive tracts. The endothelia or endothelial cells line blood vessels, lymphatic vessels, and the urogenital tract amongst other tissues. And these cells are tightly joined, so they're connected by tight junctions and create an internal physical barrier. The blood-brain barrier contains the tightest junctions in the body, and that will prevent any, let's say we get microbes in the blood somehow, they will prevent the microbes from entering the brain or spinal cord, so that will protect the central nervous system. And here I have a picture of a blood vessel lined by the endothelial cells, and if you zoom in this box, you can see this over here. The endothelial cells are connected by tight junctions. So if there happen to be any microbes over here, for instance, in the blood, they would not be able to enter the brain or the spinal cord. The tight junctions would prevent that from happening. Our first checkpoint asks, describe how the mucociliary escalator functions. So the respiratory tract is lined with ciliated epithelial cells and mucus. The mucus will trap things like dust, spores, or microbes, and then the cilia beat upward, moving the mucus layer, which we call the mucociliary blanket, toward the throat. Then this mucus can either be swallowed and destroyed in the stomach, or it can be coughed or sneezed out. For the second checkpoint, they ask, name 2 places you would find endothelia. So this could be in the blood vessels or in our lymphatic vessels. You could also say the urogenital tract or the blood-brain barrier. All right, so we just covered the physical barriers within the physical defenses section. We looked at tight junctions, the tough keratin and shedding of our skin cells, the mucous membranes in the respiratory tract with that mucociliary escalator, the mucus and peristalsis in the digestive tract, our tight junctions in the endothelia, and now we're going to switch gears and look at the mechanical defenses next. Mechanical defenses are going to physically remove microbes from body surfaces, and examples include shedding of the skin, the mucociliary escalator, and peristalsis. So you can see a lot of this overlaps with the physical barriers we just saw. Mechanical defenses also include tears that can flush out microbes, blinking, as well as urine flow. Remember that these defenses do not kill microbes, but instead they're going to flush them out of the body. Tears continually wash the surface of the eye, and blinking will spread tears across the surface of the eye as well as push debris outward. Urine flow flushes microbes from the urinary tract, which is why the urinary tract is usually sterile, except for the distal urethra, the outer end. This will contain normal skin and mucosa or mucosal microbiota. And that is why if you ever need to perform a clean catch, we're going to do this in lab. You might do this if you're trying to test if a patient has a urinary tract infection. Part of the protocol requires midstream urine. That means you need to urinate into the toilet first before you catch the rest of the urine sample. A reduction in urine flow or some kind of obstruction to urine flow can increase the infection risk since you're no longer flushing out microbes. This checkpoint asks, name 2 mechanical defenses that protect the eyes. So we saw that tears wash the microbes off the surface of the eye, and then blinking will spread the tears as well as clear the debris outward. All right, so we just saw that in mechanical defenses, we have shedding of the skin, that mucociliary escalator in the respiratory system, peristalsis in the GI tract. We have flushing by tears and blinking that protects our eyes, and urine flow that keeps our urinary tract free of pathogens. Now we're going to look at our last category in the physical defenses section, which is our microbiome. The microbiome consists of the normal resident microbes that you have on your skin, the respiratory tract, the gastrointestinal tract, and the female vagina. And these microbes will occupy binding sites and use up the nutrients in these locations so pathogens cannot attach or grow. And they can also produce conditions that inhibit pathogen growth. For instance, in the vaginal microbiota, they will suppress the fungus Candida by outcompeting it for space and nutrients. Antibiotics can disrupt the normal microbiota by killing off the beneficial, the good bacteria, and that can allow pathogens like Clostridioides difficile to multiply unchecked, which can lead to severe diarrhea and colitis. In severe or recurrent cases, sometimes a fecal microbiota transplant may be used to restore bacterial balance. So remember, for C. diff, it is not normally found in the GI tract, but its endospores are everywhere, and they're common in hospitals, in nursing homes, clinics, the soil. So if we get endospores, and in the normal person, they would be suppressed by our normal microbiota. But if you're on antibiotics and the normal microbes are disrupted, now C. diff can take over. For a fecal microbiota transplant, this is a procedure that transfers stool from a healthy donor to a patient in order to restore the healthy balance of bacteria in their gut. And it's most commonly used to treat recurrent C. diff infections, but it can also be used for other conditions like irritable bowel syndrome or inflammatory bowel disease. All right, so our physical defenses we saw included our physical cellular barriers. These blocked pathogen entry. We had mechanical defenses that physically remove pathogens or other debris. And then we have our microbiome. These are our normal microbes that compete with pathogens for space and resources. And all 3 work together to prevent infection before it can start. Our book also provides a nice summary table of these 3 groups of defenses organized by category. We have our cellular barriers, our mechanical defenses, and the microbiome. So make sure you can provide a few examples for each and describe the function for each category. This checkpoint asks, list 2 ways resident microbiota can defend against pathogens. So 1, they can compete for binding sites. Resident microbiota occupy cellular binding sites, and this blocks pathogens from attaching. It's like playing musical chairs. A pathogen cannot bind because there's already a normal or resident microbiota in that place. Another way is by competing for nutrients, right? There are good or normal microbes are using up the nutrients, and that prevents pathogens from doing so and growing. All right, let's recap 17.1. The first learning objective asks us to describe the various physical barriers and mechanical defenses that protect the human body against infection and disease. So physical barriers included the skin. We have multiple layers, the epidermis, dermis, hypodermis. The skin or the outer layer is keratinized, and we have tightly packed cells to resist microbes from entering. It's also dry, salty, and acidic on the skin surface that can inhibit microbes, and we have shedding of skin cells to remove any microbes that might have attached. For the mucous membranes, we have them in our respiratory, the digestive, urinary, and reproductive tracts, and these include tight junctions between epithelial cells, so nothing can cross in between the cells. We also have mucus to trap microbes and debris. And then we have our endothelia that line the blood vessels, the lymphatic vessels, and the urogenital tract. They also have tight junction barriers, and those are especially strong in that blood-brain barrier. For mechanical defenses, we talked about the mucociliary escalator. The cilia can move the trapped microbes up to be swallowed or expelled. We have peristalsis in the gastrointestinal tract to move everything out, which can be eliminated in the feces. We have blinking and tears to wash microbes off the eye surface, and urine flow to flush microbes out of the urinary tract. We also have shedding of the skin again to constantly remove adherent microbes. For the second learning objective, they ask, describe the role of microbiota as a first-line defense against infection and disease. So normal microbes help us compete or help prevent the pathogens from attaching because normal microbes compete for binding sites. They occupy our epithelial surfaces, preventing the microbes or pathogens from attaching. They also compete for nutrients, so there are limited resources available for pathogens, preventing their growth. Normal microbes also keep opportunistic microbes in check. For example, the normal vaginal microbiota can suppress Candida overgrowth. And we can also restore normal microbiota if needed. I mentioned that fecal transplant can help reestablish a healthy microbial community when it might be disrupted by something like taking antibiotics. This takes us to the end of our first video. In the next video, we're going to explore 17.2 on chemical defenses, and these are going to include enzymes, antimicrobial peptides, cytokines, and inflammatory mediators.